Imagine for a moment a world without art, without dance, opera, literature, poetry. That world would be a very, very dull place.
Today on the show, we have Dr. Alan Schwartz, professor of the Department of Medical Education at the University of Illinois in Chicago. He was Berkeley's very first cognitive science major, where he focused primarily on cognitive linguistics. He continued at Berkeley for graduate school in a PhD program for cognitive psychology, and years later the program in the concurrent master's degree in organizational, behavioral, and industrial relations at the Haas School of Business. He was the editor-in-chief of the journal Medical Decision Making and has authored the books Making Medical Decisions: A Physician's Guide and Listening for What Matters, Avoiding Contextual Errors. Dr. Allen, thank you for taking the time to speak with me today.
Oh, thanks. It's great to be here.
Yeah, absolutely. I always, I always look forward to speaking with people who are vastly smarter than I am because I always learn something fresh. And, that is why I kind of wanted to talk to you because, I actually only got through chapter 4 of your book, so you're going to have to fill me in on your solutions part. But honestly, this book, Listening for What Matters, it was a real eye-opener for kind of, a lot of the loopholes in the gray area in our healthcare system. And it really honestly, folks, I recommend picking it up because it really gives you a practical knowledge on why certain things why the system itself is so wasteful in general and a lot of where that waste goes.
Yeah, well, it's been a really interesting journey for me. I'm not a physician myself, but my colleague Saul Wiener, who wrote the book with me, is also a health services researcher. And that's just, I can't wait to talk about that project because it's just been so very interesting to me too.
Yeah, absolutely. So let me ask you, when you were kind of putting this project together, how long did it take you guys to actually get all the results?
Well, we started working on the problem maybe 15 years ago, and the problem was, so Saul, as I said, is a doctor, and so he's training doctors, and he had a bunch of residents who would go in and see patients, and they'd come out and they'd talk about the patient to him that they saw, and he realized when he went in and talked to the patient that the resident had gotten all the medical stuff right, but they'd missed the fact that this patient was now driving trucks at night, and so his insulin would freeze, or this patient had lost his health insurance, and so prescribing that more expensive drug wasn't going to get filled. And he began to realize that, we have a problem. We're really good at understanding the science and what you should do for the average person, but we have a real problem figuring out how people are different than the average person and what you need to do to make care work for that person.
Right. So it's more about kind of bringing a whole understanding to the care of the individual, looking at certain, life influences, finances, family life. Those are influences as much as, any physical health, or those are influences on physical health as much as the actual biology of the person. And I guess coming from a psychology background, that kind of helped you kind of look into this because, psychology, they teach you that you need to look at, the whole situation and all of their influences on a person's life.
Yeah, so that's part of it. The other part of it is that my area of psychology is actually pretty experimental. I used to say that, my job was to run people through mazes. And that turned out to be really important because when Saul came to me, he said, I've noticed this thing, and let's think about how we could actually study it in doctors. And I naturally thought, well, how could we do some experiments where we control the situation and find out what doctors would do? And that's where we had this idea of basically doing secret shoppers to doctor's visits, training actors to pretend to be patients, where we could control what was wrong with them in a kind of experimental fashion, and sending them into doctors who thought they were patients and seeing what they did.
And so let me ask you, over the course of the experiment, how many different actors did you get involved in this?
Oh, I mean, in the first study, there were, I think, 8 or 10 actors, but we've since done many additional studies. I'm sure we've worked now with, I don't know, 80 different actors maybe in 5 or 6 states.
Okay, so let me ask you, does this, I guess, does this issue, does it vary state by state to the point that, you can tell where there's less healthcare infrastructure, there's a noticeable difference, or is it centered in more like urban areas, or is there a differential, I guess, between rural and urban?
Yeah, that's a really good question. I mean, we haven't, I think, done projects that have really looked at that well enough. We've done work in the kind of Chicago and Wisconsin area, which is mostly urban, suburban. We did a big project in New Jersey where it was sort of spread all over the state, but there weren't enough, I think, kind of suburban or rural practices to really make that comparison. But it would make sense, right? Because when you think about the context of people's lives, what you do in your life is different if you, live in the city than if you live in the suburbs, than if you, work on a farm or the feed store. So, that would be totally relevant.
So I guess, looking at your research, when you were trying to get different types of context, and what was some of the most what are some of the most common types of contextual understanding that doctors kind of missed? I mean, was there, was certain specific life influences that they should have been asking about, or was it, just more emotional perceptions of things?
Yeah, we came up with like 12 different kinds of context, and the pattern of which mattered most would really depend on where you were. So we did a lot of work in the VA healthcare system, doctors taking care of veterans. And, veterans have different sets of problems in many cases, the ones in the VA system, than your folks who are going to, a private practice in the city, or your folks who are going to Cook County Hospital. They're all a little different. But really common is not thinking about financial issues, not thinking about access issues like transportation, and not thinking about competing responsibilities. Like most people, if they have to make a choice between taking care of themselves and taking care of their kid, choose to take care of their kid. And if you don't know that about them, then some of their behavior when you're trying to take care of them doesn't really seem to make sense. Why are they not doing what you're saying? Why are they, making these choices and not those choices? But once you realize there's other thing going on in their lives that is totally justifiable and is important, then you begin to be able to say, well, what could we do to take care of you that doesn't get in the way of you taking care of your kid?
Right. Huh. Well, I mean, and there's so much crossover there as well, because, if someone has financial issues and they're working, 2, 3 jobs, and, they may only have,
Yeah.
health insurance through one of them. I mean, they can't always make those doctor's appointments, right? I mean, because most doctors, if you're, working, and, if you're having appointments, usually like I'd say between 9 to 8 o'clock, if someone's working 2 jobs, that's just not doable. And sometimes you may only
Yep.
have one, day off a week, if that.
Exactly. So, if you were to do this kind of research in other countries, you'd find probably different kinds of contextual issues, but you wouldn't necessarily find the financial one, right? Because there are a lot of places where everybody has health care, where they arrange to, have access to doctor's visits on Saturdays and things like that. But, here, that's a kind of thing we've got to figure out.
So I guess how does the contextual issues, I guess, kind of hold our healthcare system back from being more competitive with those other countries that are over the pond, or systems that are over the pond?
Yeah, well, I mean, I think some of that is just that, we know we want to take care of people. We want people to get healthy. When people get healthy, it tends to be cheaper for the healthcare system, right? And also when doctors miss patient context, what typically happens is it means they have trouble explaining what's going on. And so the natural recourse in the US is you order a lot of tests, right? Which then adds cost to the healthcare system, and the tests don't come back, showing anything useful, and so on. I mean, in our first study, one of the cases was a guy, an older man who was like losing weight, and the actor gave sort of several cues that, if they'd been followed up on, might have suggested that the reason why he was losing weight was because he didn't have enough to eat. And doctors who followed that up, and the actor would say, yeah, actually, I lost my job and now I can't, get food. They'd be able to help that person, and it wouldn't be much of a cost to the healthcare system because they'd be connecting them with a food pantry and stuff like that. The docs that didn't get that, their immediate thought was unexplained loss, probably what kind of cancer, because he has no other symptoms. So we need to do the full malignancy workup, right? This guy's got to get a colonoscopy, and he's got to get an endoscopy, and he's got to get like all these tests, right, that are going to rack up costs, assuming he even goes to them. And if he does, they're going to all be negative, right?
Yeah.
And that's a big problem.
Wow. Just that alone, like, having worked at an insurance company myself, I just automatically had flashes, $100,000 in tests just coming through. And because you see that on these claims, all the time. And, it seems, I don't know, it seems strange that is such a simple question to ask someone. Are you getting enough to eat? Are you getting enough nutritional value throughout your day? I mean, I get, asking that kind of question can be uncomfortable, and a lot of folks, like, if that is your legitimate issue, like, with there's a cultural stigma that comes along with not being able to have enough in this country, right? People get embarrassed about asking for help or expressing those things, and I get it. But but yeah, it's that one in particular just seems like such a simple question that you could ask someone. I mean, why don't you think doctors take that initiative?
It's really hard to be a doctor, right? I mean, if you think about some of the other pressures in our healthcare system, I don't know what your last visit was like, but doctor's visits are usually like 15 minutes these days.
Oh, easy.
And they've got a computer in front of them, and they've got to talk to that computer as much as they've got to talk to you, right? So they're because that computer, which is supposed to be like your medical record, is also the way we do billing. So they've got to check all the boxes and do all the things that are necessary, or the visit doesn't get billed properly and they don't get paid. Right? In other countries where they don't deal with healthcare billing, the medical record is really a record about the patient. In the U.S., it's both a record about the patient and a record of what the claims for insurance should be.
Right.
So the doctors are having to task switch all the time. So one of the things that we know is actually you can be very efficient in a 15-minute visit, but it's really hard to be efficient in a 15-minute visit if you're spending most of your time with the computer and not with the patient. It's also difficult because you tell doctors about this, and usually the first reaction is, well, what you're saying is this is individual patient context, which means it could be anything, right? There's a million things that we could ask about. How do we know what to ask? Because if we asked everything, we'd be in that visit for hours and hours and hours. And what we say is, well, it's not that everything matters. It's that the patient will often tell you, right? They don't know what matters because they're not a doctor, but they will tell you what's going on with them and what they think might be important for you to know. And if you're listening to that and you're asking about it, actively asking about it, the things that you think might relate to their health care or how they're feeling, it doesn't actually require you to ask a zillion questions. When a person says something about, having trouble getting food, that's something you should ask about.
Yeah, it seems that, I don't know, almost that, they don't know what to ask about or what could be pertinent to it because, of the kind of the boundaries of that situation. Because, I mean, primarily if you're a doctor, we were talking about those 15-minute meetings. I mean, they try and crank out as many appointments as they can per day. And, I mean, if you look at it from that billing perspective, right? If you're cranking out these appointments and, they're trying to crank out those claims as fast as possible, a lot of those are going to be appealed, sent back, misdiagnosed with like procedure codes. And now you're talking about, how much additional administrative cost that is added on to that. I mean, I feel like, if you have that centered approach, if you kind of take that time, that I don't know, it's going to cut down on the administrative costs overall. But I mean, how do you kind of address that? Do we just need more doctors?
Yeah, it's a good question. I mean, in some places we certainly need more doctors. I mean, we think we need to train doctors differently. We need to help doctors pay attention to this and to make it kind of a norm that if you hear something that your patient says that you're curious about, it really is worth asking about it a lot of the time. The study we did in New Jersey, we spun off a company to do this outside of our research.
Right.
We did this study in New Jersey. And in that study, we found that for certain kinds of conditions, like everybody is really perfectly aligned. You can make people healthier and also save money in the healthcare system. So an example of that is if you figure out why people who have diabetes aren't dosing their insulin properly, and you fix that, then you save a lot of money because those people don't end up in the hospital. And it doesn't cost them any more to dose properly. And the patient feels a lot better. But there are also some cases where, say, if you do things right, it's going to cost some money in the short term. It'll, we think, save money in the long term because people are healthier. But if you get more people to get breast cancer screenings, those mammographies cost money. So in the short term, you're going to be spending more money. In the long term, that's going to get paid back. If you have a healthcare system where people stick with their insurance companies for a long time, either because they're insured by the government, like the VA or Medicare, or because, like in the old days when people worked for one company for all of their lives and they had, the company provided the insurance like Ford used to do, the insurance company reaps the benefits of what happens in the long term. So the patient gets healthier and, down the road, the insurance company saves money. And so it's great for them to invest in all kinds of prevention. It's really hard when there's a lot of instability, people changing jobs. When they change jobs, they change insurance. Insurance companies don't have the same kind of structural incentives to optimize over the long term.
Right. Well, I mean, that's why I'm kind of glad that, entering this age of data, that insurance companies I mean, not all insurance companies, but the big ones have started moving towards that prevention. I mean, when I was working there, one of my things was to do technical assistance for, all their apps and stuff because, a lot of employers now are putting together incentive programs so that different folks who decide to do, health coaching with a phone, engage with these Fitbit apps, it tracks it, sends it to the insurance company, they report it to your employer, then your employer gives you, bonus or, a discounted premiums, whatever the case may be. But let me ask you, just kind of looking at that, if these employers are going to invest into long-term plans and they're going to be utilizing this biometric data that people are, having on a daily basis. I mean, even there's this app called Happify that you just log in a few times throughout the day and report like what you're feeling from like a wellness perspective. If we were able to utilize that data and get that to providers, I mean, do you think that would be a viable, maybe not solution, but a viable way to start educating doctors on what questions are right to ask?
Yeah, that's a really great idea. And we'd have to find out. So we've done some work where we've given patients like questionnaires before they see the doctor that are supposed to elicit contextual factors that might be really important, right? So we thought, we'll save the doctor some time, we'll collect this stuff in advance, and it'll be in the medical record when they get there. We're doing a study right now where we're studying that and it like pops up as an alert if certain things are going on. One of the things in the early work like that we were doing that we found quite consistently is if the patient tells the doctor, I've lost my job and I don't have insurance, it turns out that the doctor paid less attention to that. They pay some attention to that, but they pay less attention to that than if the doctor at one point asks the patient, how is your insurance? And then the patient says, oh, I've lost my job, I don't have insurance. That is, there's something about actively asking the question, probing, that helps the doctor pay more attention to it. And I don't think that's just doctors. I think that's a general human phenomenon.
Yeah.
We've also seen it when we looked at, there's this company called Accolade that just went public that gives everybody their own like personal health assistant. And you call your health assistant and they help like coordinate all of your care. They work for your company or your insurance company usually, but their job is to be your person and coordinate your stuff. And those folks are really good at contextualizing. We studied them. They did a really good job. But even they have the same kind of phenomenon. If they ask about it and get the answer, they pay more attention to it than if they're just given the answer.
Yeah.
So it's tricky.
Well, I mean,
Psychology is tricky.
Well, I feel that just comes along with active listening, right? You know, you got to be able to know, how to probe for certain things. I mean, just having a good conversation, you got to ask those probing questions and kind of, shift the conversation in the direction you want it to go. But
Yeah.
I mean, I don't know. Do you think there would be beneficial? You were talking about these health assistants. I mean, if different, doctors' offices, clinics had social workers there to be able to assist with folks that might be dealing with, other factors in their lives outside their physical health. Because I know that like a lot of like, county ran clinics have that, but, a lot of major hospitals don't.
I think there's no question that would help. One of the things that doctors do say, when you get them to talk about like why they don't want to ask these questions, is they feel bad doing it because they don't know what they would do with the answer. Like if I asked you and you said you didn't have access to transportation or you didn't have food, I would be stuck. I wouldn't know what I was supposed to do for you. And doctors don't like to feel helpless any more than any of us do. So making sure that they know, okay, if you identify these kinds of problems, there's a resource available to you. And it might be you could give them to the social worker who works with you, or it might be you have a big database of resources, or, whatever. But just that you feel like this is actionable information, not just information.
Yeah. And it is so sad that because, I mean, I don't know. I mean, from a standpoint that, the providers, when you're in such a high stress job that you don't want to kind of have to deal with that additional emotional distress. I mean, I can completely empathize with that. But at the same time, it's, I mean, it's sad that that's one of the main reasons why. Because you'd think that there would be a plethora of resources available to assist folks, but I mean I guess that just goes along with the lack of funding that we've had for public health care, and I mean just public social services and resources in general.
Yeah, no, and there's a lot of, now there's a lot of interest, a lot of foundations and a lot of researchers are interested in exactly this problem. How do we align medical care with other kinds of social services that people need? They might need legal help, they might need childcare, they might need access to things. How do we make everything work so that they can stay not only healthy, but like productive and happy and all of these other things that we want for ourselves and for each other?
Well, I mean, I don't know. I feel like in this country, the financial stress is a big one because I mean, I feel like a lot of folks they don't even bother going for preventative appointments and physicals and things like that because they're afraid of what the answer could be. Very similar to what we were talking about with the doctors, right? I mean, that
Yeah.
kind of willful ignorance that if you don't address the problem, it doesn't exist because they wouldn't be able to afford what, let's say, a $300, imaging bill that goes straight to your deductible. I mean, I know a lot of
Right.
folks can't even afford their, $2,000, $3,000 deductible, let alone their out-of-pocket maximums.
Yeah, right. And I mean, and that's just medical insurance, right? Then we all also deal with dental things, and we all deal with like, vision, and many people don't have insurance for those things at all. It's all out of pocket, and you find yourself in these terrible choices. Like, what am I going to spend my money on? I know, and if I find out something's wrong with me, I'll feel really bad about it. So maybe it's better not to know. And then, of course, that leads to, like, you never deal with it. It gets worse and worse. And by the time you have to deal with it, you're pulling out teeth or amputating limbs.
Yeah. Well, I mean, dental is a big one. A lot of folks don't realize how important dental health is. I had a buddy who, he probably never had dental insurance in his life. I mean, a lot of folks don't have dental, and employers should do a better job providing that. But yeah, he had a tooth that rotted out, and, he had ended up infecting his nervous system in his jaw, and that just spread. And now, he is having, muscle spasms and stuff like that. And all of that was, that's something that could have been easily prevented with, a couple of cleanings per year.
Yeah, tooth infections are bad. They're bad.
So I guess let me ask you, so when you're looking at kind of, ways that we can reform the system, I mean, do you think that there's things that can be done within the industry, or do you think it's better to go kind of and push more towards a public option and go that route?
I mean, I think it's a yes and. I think, we have to do all those things. I think when you compare the U.S. to countries that have universal single-payer healthcare, whether it's government paid or whether it's through insurance companies, it varies how they do it. But I mean, those countries spend less money and get better health results for their population. So that would be a good thing to move towards. But we got to live where we are now, and where we are now, there's a lot that can be done, with doctors who want to help people. That's why they got into medicine.
Right.
To give them tools to make them better at doing that.
Yeah. So I don't know. I guess kind of looking at the tools that are available. I don't know, what are some things doctors can do to try and increase their awareness of context, and I guess what sort of things should we as patients let them know?
Oh, so that's a great question. Those are both great questions. I mean, on the first one, right? So like you said, I work in the Department of Medical Education. So, we're really interested in how you train doctors. So there's some educational things in terms of having doctors, a lot of people don't know the way doctors are typically trained now. They get into medical school, and they spend the first couple of years really just studying science and taking tests. And then they get thrown in to see patients. And they've learned all the science, but it's not clinically relevant right away. And there's sort of this big gap. And a lot of medical schools are trying to find ways to smooth that out a little bit. But right from the beginning, it's helpful for people who want to be physicians, who want to be healers, to be thinking about not just disease, but patients, people, right, that they're going to care for in their whole lives. So our medical school and many others have do that to some degree through the humanity, through missions in the liberal arts and sciences to think about what healing means, what disease means to people, right? Saul and I, of course, are interested in sensitizing people to sensitizing physicians and training to context and how it can be important in healthcare, that it in many cases can be as important as understanding the biological mechanisms that are going on. And then once docs are in practice, they have to do certain kinds of like professional development on an ongoing basis to maintain their licenses. We've argued that a really good kind of professional development program is to use direct observation like we do with our actors, like is to use secret shoppers, or in some cases we've done actual patients with carrying hidden tape recorders, where someone analyzes what goes on in a bunch of visits and just holds a mirror up for the doctor to say, look, you saw all these patients, here's how often you asked about things that stuck out to us as things that were unusual, and here's how often when you did that you got back an answer that changed your management of a patient. Don't you want to do that more? So that's what we do in the VA. We do that in 6 VA systems right now, and it has a big effect, that kind of audit and feedback.
Yeah.
there doesn't have to be a carrot or a stick, right? People want to get better. And if you show them, here's how you're performing and tell them, and you could improve in this way, they often will.
Yeah. That takes a mature mindset because, I don't know. I personally never like to get performance reviews. I don't think anybody does, but everything we always strive at to be better, physicians included. So I
Think of it
guess,
as coaching, not as a performance review, right? Think of it as
yeah.
you're playing baseball and you have a coach.
So I guess let me ask you then, once these doctors were confronted, right, with their shortcomings in certain areas, how quick were they to get those resolved? Did you guys have a program that was put in place, that kind of specialized, how these individual doctors could be better and what questions they should be asking?
Yeah, so in a lot of our work, we're doing multiple rounds of auditing, and we're giving them feedback over time. So when we're doing it in the VA system, we're using actual veterans who carry these hidden recorders, and then our research team analyzes them and anonymously feeds back data to the providers on every couple of months, so they can see, and we can show them charts. They can see sort of if they're improving, if they're not. And we give them specific examples of cases where they did really well, and cases where we heard things where we would have asked a question that they didn't, or we heard an answer that we think should have affected the care plan and didn't. Now we're not taking care of the patient; we're just listening to these visit recordings.
Mm-hmm.
But we've shown that when they do contextualize care, we've actually demonstrated by looking at the patient's charts 6 or 9 months later that the patients get better than when the care isn't contextualized, and the doctors pay attention to that.
So, I guess going into the VA, when it came to the contextual errors, what were some of the big differences you've noticed between the VA system and some of the for-profit hospital systems out there?
Yeah, well, the big one, of course, is that patients are being taken care of at the VA usually don't have a financial issue with that, right? The VA is providing their care,
Right.
whereas in outside private practice, finances is often, as we've talked about, kind of a barrier. In the VA, the barriers tend to be more like some of those other ones that I talked about: competing responsibilities. Sometimes it's access, although the VA is pretty good on transportation. It can be sometimes, as you brought up, emotional or spiritual beliefs. It can be that, Saul had a case that he told me about where, the veteran, when he was a kid, had just had this really traumatic experience with doctors. And he never wanted to interact with doctors. And so he said as little as possible all the time, had to be dragged there by his wife, usually. And that was a big stumbling block. Like, it was really important in his healthcare because of the conditions he had, that he'd be able to interact on a regular basis with a doctor. And that kind of past experience is context about why he was not showing up for appointments or not calling when there was a problem that he really needed to get help with.
Yeah. Well, I feel that's got to be, one of the biggest barriers just with working in the VA in general is, even though they have a lot of resources for, mental health, they have caseworkers and that, like we were saying, right there in the building, they can, send them down a couple of floors and they can, get their needs addressed. But just that trauma that, that makes a lot of guys, not want to express those feelings because, sometimes they're just that painful.
Yep.
That issue's got to be so prevalent there. Let me ask you, what were the difference in like questionnaires that you were giving like VA doctors as opposed to, more or private in practice doctors? Was there kind of a shift more towards emotional needs?
So when we were doing experimental studies, we were using the same, basically the same experiments in the VA and out of the VA.
Okay.
That's one of the questions in that study, which was originally funded by the VA, was whether the VA doctors performed any worse than the doctors on the outside. By the way, they don't. The VA doctors are great. So So we've done the same things in both groups, and then when we look at just kind of the the VA patients as we do now as an ongoing quality improvement program, we don't have a comparison to non-VA for those folks. So we're feeding back, like I said, stuff about access, stuff about emotion and spiritual and competing responsibilities and so on. But we don't have the same scale of work in private practice with real patients to know.
So kind of going off what you were, saying, what are your thoughts? This would kind of be like outside of your study, but, more in general. What are your thoughts on implementing more spirituality in our healthcare system? Because, you go to, you got to go to other countries, I want to say primarily less developed countries, but, there is that connection between the spirit and the body, or I guess, you could say like the existential purpose in the body. And do you think that is something that we could implement?
That's a great question. Ours is not the only system of medicine, right, of healthcare in the world. There's very old, traditional Chinese medicine, and there's Ayurvedic medicine, and a lot of those other systems, really do think more about the mind-body connection or the spiritual components of health. So how you make them work here is tricky, because I don't think that you can just add them on to medical training in the same way. I think it's its own thing.
Right.
But for some patients, that might really be much more useful to them than traditional Western allopathic medicine. I just don't know how to tell who will most benefit from which.
I feel like a great way to determine that would probably be more education for patients about, the connections between their thoughts and their physiology. Because, a lot of folks don't put together the influences of, stress or bad relationships or home issues, those emotional, those mental problems that we have. We don't really, see how that affects the body. That connection isn't there for a lot of folks in this country.
That's true. There's a lot more interest in kind of mindfulness and resilience and things like that these days. I think, and knowledge about the impacts of stress on us mentally and physically. I think, a little bit of a danger there, though, is if you say to people, wow, you're really stressed, you should start meditating. And the reason why they're really stressed is, they don't make a living wage. They're being oppressed because of their skin color. There's all these sort of societal things from the outside. It's almost like saying, well, you got to fix that yourself. Go and meditate, and then we don't have to fix society. And we probably need to also fix society.
I don't know, man, like meditation, deep breathing. It's a great coping skill in the moment. You know what I mean? It's not, it can definitely bring a fresh perspective, to situations or events within your life, but it's not going to solve them for you. I feel that, if we're going to focus on, how to transform society, technology is going to be a way to do that. So I guess, let me ask you, what sort of like technological advancements in medicine are you finding kind of most inspiring for the future?
Ooh, that's an interesting question. I don't usually think actually that much about technology, oddly enough, except as an impediment in a medical visit in terms of electronic health records.
Yeah.
I do think the world is really different now that everybody carries a computer in their pocket, that's obviously been a huge change, and I think we're going to see more and more kind of health apps and stuff like that. We're getting close, I think, to states beginning to do contact tracing for COVID-19 with smartphone apps. And the problem, of course, is that like many things, technology is sort of neutral, but it's been abused in the service of profit and self-interest so much that people are now very skeptical and concerned, and maybe rightly so, about it about the implications of any technological advance. I mean, I used to be, I'm still a recreational computer programmer. I still do a lot of programming, but I was a computer guy from like way back, from '78.
Oh,
And
wow.
I love like what we can do. Yeah, I had an Apple II a long time ago. I love what we can do technologically. I mean, it's just amazing. But I'm not, in those days, like those of us who had computers were a very small group, and we all thought all information should be free. And it was a very kind of naive and idealistic perspective. And then the profit motive kicks in, and nobody can be naive anymore.
Well, I mean, I don't know. I feel that people should definitely, have a suspicion when it comes to technology. I feel that, that is well warranted, primarily when, we have seen big tech just exploit, the consumers of that technology at every single, every opportunity they
Yep.
had. Excuse me. But at the same time, though, I feel like, like you were saying, more free and open technology is, or more free and open data, I should say, is going to give us so much more to work with, so much more tools at our disposal.
Yeah, I mean, at heart of it, the issue is not technology, right? The issue is people.
Right.
And do people want to work together and be cooperative and create communities that are interdependent and self-reinforcing, or is everyone out for themselves?
Right.
And you get very different, worlds depending on how you spin that question.
So I guess, I guess I'm, looking at kind of like, the future of technology, or I guess the future of healthcare, and, that future being focused on more patient-centric care. What are your thoughts on like the developing techniques of CRISPR and some of the, DNA programming, um, DNA programming advancements that we've seen to where, now they're actually able to, program someone's DNA into stem cells and, grow partial organs, tissues and things like that. I mean, do you think that that kind of a focus when you're, just looking at, individual genetic structures will be able to solve a lot of this, solve a lot of these contextual issues as well? Because, you have, I mean, an entire, you have an entire genome now that you can figure out, and you can have have an entire medical history generations at your fingertips.
Yeah, I mean, I think it's got incredible potential, the sort of personalized genomic medicine technology. Um, I'm not a genetic scientist. I don't know what all they can do, but what I've read, right, is incredible potential. What I am, right, is a social scientist. So what I worry about is who will have access to it, how will it be used, right? Will that potential be realized, and will it be realized equitably? Like I worry more about kind of the social and ethical implications than I do about the actual technological capability, because honestly, I think, with enough time and effort and brains, we're technologically capable of almost anything. In the last 50 years, the technological advances that have gone on are just so staggering that, we could get to wherever we want to get to. I just don't think we spend enough time thinking hard about where do we want to get to.
Right. Well, I mean, I guess, as a culture, that just becomes that's just because everyone's so focused on instant gratification, right? In the financial sector, short-term profits, it's all about the now. We don't
Mm-hmm.
care about what the should. Well, we're so interested in what we can do. We're not interested in what we should do. Um, but I mean, you just talk about, the advancement of medicine, right? In such a short period of time. I mean, I often think about
Yeah.
myself, absolute with only the bare minimum, right? Medical training. If I were to go back, I don't know, back to the 1860s, I would be the most advanced mind in the field of medicine, right? And you think about
Yep.
what that'll be like 100 years from now down the future, and like it's I don't know, it's really awe-inspiring.
Yeah, no, I mean, even things like in our not too distant past, when I think about like the HPV vaccine,
Yeah.
right? We prevent cancer. We prevent a kind of cancer now. We've figured out how to do that once, right? And not just screen for it and then treat it, like prevent it. That's amazing. And if maybe one day we'll figure out how to do that for another kind of cancer and so on. Some of those advances in medicine, and some of them seem like small things, but are just really enormous.
Well, I mean, yeah, I mean, you just think it like, everything, it takes place over time, right? It's, step by step.
Yeah.
But I guess let me ask you, so when we're kind of looking at, that advancement, I mean, what sort of breakthrough, actually, no, how do I phrase this? I guess we'll take a step back because, there's a better avenue to the question I wanted to get to. So you had mentioned COVID.
Okay.
And the one thing that I will say about COVID is that it has, I mean, for as terrible as it is and for as, awful as the results that we've had around the world with this disease, in this country in particular, I feel COVID has exposed both the economic, social, and or social issues, as well as all the gray area and loopholes within our healthcare system and how those things fail every day. And I don't know. I guess. How do you think COVID, and in the long term, is going to change our healthcare industry for the better?
Ooh, that's a great question. I mean, I think one of the things that COVID has forced us to do is a lot more telehealth. And I think that that's actually to the good. I think it's an important add-on to what we were used to doing, because it does make it possible for some kinds of visits and triage and things like that to happen more efficiently. And that is both good from an economic standpoint in terms of healthcare resources, and it's good because people might get in contact with the healthcare system sooner when they really need to know, like, okay, you got to go to the hospital, right? I had appendicitis a few years ago, and my wife diagnosed it. Basically, I was lying in bed. I'd woken up. I was like, oh, my stomach feels weird. I think I'll, take an antacid. I took an antacid. Like, this is still weird. It's like uncomfortable in a way that it hasn't seemed uncomfortable before. And so, she starts Googling for a while, right? Dr. Google. And she's like, there's, for what you're saying, you could have appendicitis. Maybe we should go have you, go to the hospital, have you checked out. And I'm like, really? You think appendicitis? And she's like, well, you're saying it feels really different. And I'm like, yeah. And so we go to the hospital, go to the ER. And yeah, lo and behold, I have appendicitis, and I've caught it so early that weird, uncomfortable feeling was all the pain I ever had. I mean, they put me on ketorolac when I got there, so I wasn't going to have any pain anyway. But I had the best possible appendicitis anybody could have, right? I never really hurt. I just had a little discomfort. They're like, yeah, we got to get that out before it bursts. They do laparoscopic surgery. Like, the recovery time was fine. It was like an amazing healthcare story to me. And I think that, the telehealth enables that kind of thing more easily. So I think that's something that hopefully we'll see. I think the other thing that you mentioned is it has exposed, in a way that mass natural disasters do, a lot of fault lines in terms of who can get care and who can't, how easy is it to get care, where can you get care, what can the government do to help people, and when does that work and when doesn't it? And I hope that, people will go back the way they did after, say, the explosion of the Space Shuttle Challenger, and do a post-mortem and figure out, like, okay, this is not the last time we're going to have natural disaster, a pandemic or otherwise. What should we be doing to prepare? And there were always been folks doing that, but they haven't always been taken seriously.
Right. Well, I mean, I don't know. I feel that like with COVID in particular as well, well, I guess before I go there, going back to the telehealth connection, I hope that becomes
Yeah.
more of an industry standard because I mean, just think about ER visits, right? If you have the telehealth connection and you call up your 24-hour nurse or you call up, whatever doctor's on shift via, whatever Skype program they have,
Yep.
you think about how many people are going to avoid going to the ER if they know that they can wait till the next morning and go to an
Yep.
urgent care. Or it's, ends up being not that big of a deal. It's just indigestion. You'll be fine, right? I feel
Yep.
like, the more information that you put at people's fingertips, the better they'll be, the more informed choices that they'll make. And primarily healthcare, I feel, is such a confusing industry in this country that people don't know how to make the most informed decision as a consumer. And I think that's one of the biggest reasons that we have so much waste and cost.
Yeah, well, so it turns out, so this is my area, right? Psychology of decision making. It turns out that the more information you give people, not necessarily the better they do, and that's part of the problem. Is that you have to know what information to give them and how to present it. In many cases, in order for people's brains to use it the right way.
Right.
So we're deluged with information. Like it's really hard to figure out a lot of things. If you think about, one of the things I never got to study, but I've always been interested in is how do people pick their doctors? A lot of times it's based on almost nothing, right? There's a lot of information out there, but we don't know how to use it. We don't know if it's really useful. We don't know, so you pick somebody who your friend knows. Well, that's pretty good, right? Because if you think your friend thinks like you and wants the same things out of their healthcare that you do, then maybe their decision is a good start for your decision, right? Assuming you have a choice of doctor at all. But that's a situation where, right, you have very little information. What you have is a recommendation from someone you trust. So sometimes we need a lot of information. Sometimes we need the right kind of information or from the right sources. It's very tricky. The other thing that I would like to see happen technologically with respect to COVID, and we were talking about a little earlier, is if we could come up with app-based contact tracing that people would trust, that was provably privacy protecting, that could have implications way beyond COVID, right? So there are other communicable diseases that we worry about, other infectious diseases, and we could do things about that too, right? We don't just have to contact trace for one thing.
Yeah, yes. From working at an insurance company, it's for most folks, like you said, it's, go see my guy. He's the best. I told you he's the best. Hey, Larry, is he the best? Yeah, he's the best. And so when you have, your friends kind of like pushing you on, you on it, that's usually one of the biggest inclinations. The other one I think is convenience. The majority of, we did an audit on the website one time and, just like different features that are most used. And the majority of time, it was either ID cards or the provider search. And the only provider search people use for the most part was distance. They just look up a doctor, type in distance, and, the closest one, that's who they go to. And, you don't really have too much history about, general practitioners, right? You don't really have too much to go on there besides, their name, a profile, and maybe like what, of a star ranking system. So yeah, you really don't have, that much information available to you. And a lot of times, people don't even know who's in network and who isn't when you get those recommendations, nor do they even bother to look it up.
And sometimes it's not even the case that the same doctor is the right doctor for everybody, right? So you and I might feel very differently in terms of our attitude towards risk or our how we feel about different kinds of screening or testing or whatever. Like there are some things that are not proven in medicine. They're up to the patient and they depend on what your preferences are and how you want to live your life and, what outcomes are important to you. And I'd like a doctor who understands those things and has a similar perspective that I do. Like, if I know, let's take an extreme example, if I know that I wouldn't want to live on a ventilator with no hope of being removed from it, Like, I would prefer to have a doctor who understands that choice. It doesn't have to be their choice, but they have to at least have heard that that's my choice, and that they're willing to, when the time comes, help me enact that choice. And that's hard to find out you can't find that out from a website, right? It used to be you would, if you were lucky, you could go see a doctor, sit in their office for 30 minutes and just talk to them, right, about your health and about medical care and about their perspective on things. We don't really have visits like that anymore in most places. So what happens is you pick the convenient doctor, and then hopefully you never have a crisis. But if you ever have a crisis, that's when you really find out, like, am I going to stick with this person? Or if I have the option of going somewhere else, like, did they fail me when I needed them? And that's really kind of a terrible way to have to choose a doctor.
Yeah. It feels like, just like the human connection in a lot of ways has just been removed from the situation. Like you're seeing a patient as, a patient, or, a number, that you have to see throughout the day, but you don't really get to know them as an individual. But I mean, I don't know. I feel like that almost echoes, the greater society in which we live, is that people don't have conversations anymore. Like, a lot of folks don't sit down and just do like a long form discussion, or, sit down and have those soul searching conversations that, they used to before we had so many other options for entertainment at our disposal. Right. Um, you know, you look at, once smartphones came around, you look at how many people, don't, don't bother to even call someone on the phone, right? You're just sending folks a quick text message nowadays. And I don't know. I feel like that's not isolated to the healthcare industry. I feel like that's just, I don't want to say, human progression, but, almost regression.
Yeah, I mean, I can see that. It is really important that people stay connected with each other, and the more bandwidth they have for that, the better. And texting is not a lot of bandwidth for it.
Yeah. Well, I mean, I don't know. I guess that's also, I guess the other thing that COVID is going to do, I mean, is change the way that we communicate, right? Like before COVID, I preferred to actually do these podcasts in person. I invite someone over, we'd sit across the table, drink some whiskey, and, you actually are able to have more of an, the dynamics of the conversation are a lot different, right? And, with COVID, with social distancing, for a lot of folks, Skype, Zoom, Facebook Live, whatever the case may be, those are becoming the primary ways people communicate with each other. I mean, I don't know. I can't really go and see my grandma for obvious reasons. She's got lung issues, and we're on this app called Marco Polo, where we just kind of like send little videos back to each other. And, that's sadly, that's going to become, more of a staple for how people communicate.
Yeah, I mean, it's really weird. And we're all going to have to, get used to what we have to get used to, and then get unused to it again. I haven't been in a store or restaurant or any enclosed building with another person for literally 5 months, and I haven't been within a person outside of my household in 5 months. And that is bizarre to me. Right? I mean, I'm having all of my, groceries delivered and stuff, and I don't go to work. I work from home. So like that, and in the beginning that was really hard, and now it's less hard, which means that's getting habitual. And to make the shift back is going to be weird, right? I mean, I kind of want to make the shift back one day, but it's going to be strange.
I mean, yeah, you think about like, the economic influences of just that, right? Being able to work from home, because COVID really showed how many jobs. I mean, it's just unnecessary for people to go to the office, right? People are still going to meet their quotas if they can work from home. I mean, when they shifted, my job shifted everyone to working from home. And, productivity has not gone down at all. In fact, it's boosted because, people, they don't have to deal with the stress of getting up and driving and being in traffic. And then when they get in, they're usually running, if they're anything like me, 5 to 10 minutes late, and then they got to get everything situated, be there on time. And, with working at home, you have the ability to, kind of take your time, right? If you don't want to wear pants, you don't really have to. But I guess, as well, with so many people working from homes, you're going to see a lot of these a lot of these buildings and corporate spaces that companies were renting out, kind of shrink down to only like maybe certain boardrooms and stuff when they have to meet in person, right? But that's going to give so much extra cost to companies. I know that they won't, right? But I'm hoping that that can help offset some of the healthcare costs because, like, man, we think healthcare costs are high. Just wait till after COVID when all that money's been spent. Premiums are going to skyrocket like we've never seen before.
Yeah, that's a real problem. And hospitals, there are many hospitals that are going to be coming very close to failing because taking care of COVID patients is not the way a hospital stays afloat, right? And whether you like the economics of healthcare or not, people do like having hospitals. Yeah, it's the reimbursement on COVID care is not good. It's really going to shake a lot of things up.
So I guess I don't know. Looking forward, then in a post-COVID world, well, actually, I guess let's take a step back. So I'm sure you've been staying pretty up to date with the effects and the stress that COVID's put on certain markets and that in the area. So what are some of the long-term consequences you think are going to have in the healthcare system because of COVID?
Yeah, it's a good question. I mean, the first thing will be just weathering it, right? Like I said, hospitals and stuff staying afloat, and not just hospitals, right? If people aren't going to see their optometrist and they're not going to see their dentist and stuff like that, like, those people aren't going to be able to stay working forever either without any patients.
Yeah.
So there'll be big economic shakeups just like for everybody. But then of course there's all the people who are going to get sick and who don't have health insurance, and it's going to be the drain on their family resources, and maybe now they don't have a job either because there's so much unemployment and there are so few jobs to go around. I mean, it's really very, very distressing to me. So what changes will happen? Hopefully, we'll get more regular telehealth. Hopefully, we'll get better public health preparation for the next time. Hopefully, people will stand up and say, this is not the kind of healthcare that an American should expect. And we want our state, our government, our companies, everyone to do better, to care about all of us as stakeholders and not necessarily just shareholders.
Yeah. I don't know. I feel like, my biggest fear is that, if they don't get these stimulus packages passed and we don't keep people in their homes, like once you start seeing the housing market collapse again, and you're going to see hundreds of thousands, if not millions of people out on the streets. You think COVID is on the rise now. Just wait till all those people are living in shanty towns with poor hygiene. You're going to see death rates go through the roof. And, oh God, that's a terrible thought. But I guess,
It is.
yeah, because we don't have in this country a social services system, or hell, even an unemployment system that's up to the task of meeting people where they're at with this crisis. And obviously, as we've had absolutely no federal response or organization in any sort of efforts to try and combat COVID. So I guess I don't know, what should we be focusing on as people living in this time to put pressure on the government and companies in the right way?
Oh, your guess is as good as mine. I mean, one of the things that we learned that that really surprised me in some way was, a lot of the talk about the federal unemployment program is driven by limitations in the computer programming at the state level. Like all these state unemployment offices have, I imagine somebody wrote COBOL programs or something a long time ago that do the checks, and there's no one around who can like modify them if they want to send out extra checks or whatever. Like there are some technological constraints that are just astounding to me. What I think we probably need is something like the New Deal. I mean, I think we need to put people to work improving the infrastructure of the country. If there's no private employment to be had, I think at least, and this is not me, the researcher, just me, Alan, I think it's okay for the government to give people jobs that will help other people. Like, let's build roads that are breaking down. Let's do that stuff. Like there's work to be done. People can, and that will generate, a viable economy as well as infrastructure that will support the economy in the long run. That's what I would do if I were king, I guess, is I would try to, support folks at the same time as trying to deal with some of the other problems that we have that could be shorn up if you had a large available workforce.
Right. Well, I mean, I don't know. Also, like, the idea, right, of expanding infrastructure. I mean, I like to think big. So, yes, of course, rebuild the roads. Of course, repair all the bridges, especially that one over in Joliet. Yeesh, I drove over that. Every time I drive over that, I feel like I'm going to fall through, right? But also as well, there's no reason why anywhere in this country, with, the exception of like, certain like super mountainous areas where it's not, viable. But there's no reason that, any rural community in this country should not have high-speed internet, right? I feel like if you,
Mm-hmm.
put that high-speed internet across the country, I mean, primarily with, this focus on work-at-home jobs that you're going to have, a lot of those communities that didn't have jobs will now see new markets open up for them, even if it's just, customer service jobs, stuff like that. I mean, you're going to see a lot more money come to these rural areas that, there just hasn't been that influx on. And, you'd hope that would help rebuild the healthcare industries in those areas as well, because one of the things that always kind of terrified me about moving too far south is that, sometimes you're 45 minutes to an hour and a half from a hospital. And that's, I mean, I just think about, having a heart attack and being an hour and a half away from help. Like that is, that scares me.
Yeah, I mean, and if you've got people who you can't get jobs for, can you do some kind of training program? Like, why doesn't everybody get certified in CPR right now, right? Why don't why don't we pay people to become, you can't make them nurses maybe, but to be like lay medical helpers, to give them some training that will enable them to contribute to their communities, to our communities, until we can find them employment that they can do the rest of the time. I think a lot of people would like to make a difference, would like to have something to do.
I think that desire to want to make a difference is kind of the thing that that this country needs to kind of unify together. You know what I mean? Like that big public service initiative. Get a job, help out. I mean, I feel like
Yep.
That's what made the New Deal so effective. Is that it had this kind of theme of patriotism behind it, right? Like this is your duty as an American, to pitch in, help out, and we're all in this together. And I feel like that's what's missing right now is, I don't feel like we're all in this together. I feel like there's certain folks that are exploiting the situation to make profits, and they don't care if things get better because of it.
Yeah, I mean, it's not like, we should have looked at this like World War II. I mean, we should have looked at it like any of those times when the country came together, made some sacrifices in terms of a greater good, and felt like, they had leadership that was leading them in a good direction. I was really impressed by UIC, where I work, my dean in the medical school, who, when all this COVID stuff started, he basically said, look, some of you, the sacrifice that you're going to make is you're going to be here taking care of patients, and we're going to take care of you because we know that you're putting your life in danger to do what is your calling. And some of you, like me, the sacrifice you're going to make is you're going to go home. You're going to work from home, even if you'd prefer to come in and see people. And it's a lot easier to run a department when you can actually see people in person, because by going home, you're reducing the chance of things spreading around here that will affect the people who are taking care of the people who need to be taken care of. And I don't feel like my sacrifice is the same as an ICU nurse, but we have a sense of shared sacrifice. Like, we each have a role in what we're doing about this pandemic, even if that role is stay home, keep yourself healthy, keep the corridors in the hospital low density so that we don't have an outbreak.
Yeah, and I feel like I don't know. I feel like particularly that's what's missing from the narrative about wearing masks, because the whole like framing of shaming a person because they're not wearing a mask, that's not a winning argument. I feel like there needs to be, and I would hope that Biden gets up there and he starts talking about how wearing a mask is a patriotic thing, because what patriotism really about is sacrificing for your fellow citizens, sacrificing for other Americans, even if you're just sacrificing your comfort about having to wear a mask. I know you didn't brush your teeth this morning and it kind of smells when you have it on. But just kind of connecting, those themes of patriotism and sacrifice, and, kind of reinforcing that idea that, there is this collective sacrifice that we're all a part of that benefits each other.
Yeah, no, you're 100% right. When we first had the shelter in place in Illinois, my son got sent home from college at his spring break, and he had a friend of his who was in California, who came with him and stayed with us for a month before we could safely fly him back. And his family had lived in Japan. His father was Japanese. They had been there during the Fukushima nuclear reactor disaster. So he'd been in some pretty dicey situations. But that's the first thing he said. This was back in mid-March, was, it's so strange that in America no one wears masks all the time, because in Japan it just if you're going to be in public transit, if you're going to be somewhere with a bunch of people, it would just be rude.
Yeah.
You don't want to get other people sick. Why wouldn't you wear a mask? And people appreciate it, right? But because there, of course, people are not wearing masks because they think it's going to help themselves, right? They're wearing masks because they think it's socially inappropriate to share their cold with someone else.
Yeah,
right?
yeah.
And that's a cultural value, right? I agree. We need a patriotic cultural value about, it kind of sucks. I don't like wearing it either. But it's like rationing sugar during wartime. Sure, you wish you had all the sugar you could use, but you're doing it for a reason and you're helping.
I was actually looking up, just because of all this going on, I actually did a look at did some research on the Spanish flu, and there was a huge anti-mask movement at that time. And, I didn't know that. So I found it super interesting how things change. They still remain the same, right? And, what they ended up doing is they ended up or they enforced the mask mandate, not through the government enforcing a mandate, right? But there were all these independent organizations like, mothers' health groups, women for, whatever. But they started pooling resources and they just started buying up ad space everywhere. So you saw all these, I can't say if they were, nonprofits at the time, right? But, these advocacy groups actually coming together and, being the cornerstone of the cultural movement that was pro-mask, and, using the same kind of messages, right? Patriotism, sacrifice. They were able to change the narrative on that.
Yeah, I wonder if that would work today. I wish it would.
Man, I feel, we weren't as divided as we were back then. It was right before, it was right before the Roaring 20s. So things weren't necessarily as divided as they were in Reconstruction times, in like the 1880s. It had been, good 30 years past that. But yeah, I mean, I don't know. It's almost like you were saying before, we were talking about people having too much information and it not creating good choices. That is one of the reasons why I do think that we have so much division, is that we have so much information out there and so much false information out there that our own personal biases prevent us from being able to, recognize what is fact and what is, opinion, or, quote unquote truth, or, subjective opinion. Um, but I don't know how you develop, right, that kind of an advocacy and public education program when you have so much disinformation out there. I mean, I feel like that's one of the reasons why COVID is such a mess that it was, is that, people didn't know from the very beginning. People didn't know who to trust. They didn't know what facts were correct, right? From the very beginning, the Chinese were giving us false numbers. The CDC was receiving false information. So that put them at blame. And then, powers that be exploited that to their own advantage to try and dissuade people. And that just blew up in everybody's faces. So, I mean, I don't know how we cut through that nonsense.
Yeah, I mean, it didn't help that, all of that initial messaging about don't wear masks because they were worried that they couldn't trust people to, that there weren't enough masks for healthcare workers and that people would start hoarding them. Like, that messaging really screwed up the whole mask thing too. And I don't know what we do about it either. It's the kind of thing that keeps me up at night, is thinking about, I see all of the great value that in many ways our the internet, social media, the closer connection and the immediate connection of people has provided, but also because of the way our brains work and the way our society works, the potential for just, amplifying error, amplifying disaster, and I don't know, callousness is just very troubling. I don't know. You have some ideas. Do you know what to do about it?
I mean, I'm just still in shock about how surreal the whole thing got, right? It started off with the SARS outbreak that we have prevented multiple times before in the past. I believe right in the same area too. What was that, in 2000 and 14, 13? Had an outbreak as well, and we were able to, get that wrapped up within 6 months. But just how surreal the misinformation got to now you have, a government promoting, doctors, quote unquote, that believe in demon sperm and alien DNA and I mean, sexually transmitted ghosts. Like, what are you talking about? Like, come on, how? Like, how?
You should talk to Oscar Elaine. Yeah.
Oh man, like, I actually when COVID first broke out, he was one of the folks I reached out to, just to try and gain a better understanding about the systems, how they work and how they should work, and kind of the deliberate choices that were made about how these systems were specifically chosen not to work. Like, I personally, and this is just my conspiratorial sense getting to me. I feel that a lot of this outbreak was specifically ignored to sow as much chaos as possible, because certain folks in power benefit off of chaos and benefit off of trying to create a narrative.
Yeah, I'm not usually of a conspiratorial bent, but I could see that. You could talk me into that one. Yeah, it's, again, it comes down to self-interest versus interdependence in so many ways.
Well, I don't know. That's one of the things that COVID kind of gives me hope for, is that we have been so focused on individualism and self-interest, as a culture for so long, because quite frankly, we haven't had anything like this before. Well, I mean, we've had things like this before, but we haven't had anything like this in such a long time that we weren't forced to be interdependent. in on each other. We weren't forced to, work in these, with community groups, food banks, helping people, get what they need, because we never had to. You know what I mean? I mean, what we're about
Mm.
3 generations from World War II at this point. So, like, really, I mean, any sort of like real struggling as a society has, I mean, that's a distant memory. People don't have that life experience. I mean, I know my great grandma did. That's why she canned everything that she had and kept every screw in a peanut jar. But I think that COVID is going to bring a lot of people together in the long term because they're going to be shown the importance of working with each other and interdependence. And I'm hoping that that kind of new mindset for, primarily people who are younger growing up in this era, I'm hoping that has some long-term effects and kind of evolves our culture into something that's not as self-interest focused.
I hope so. I mean, one of my hobbies, I like to play board games, and in particular, I'm interested in cooperative board games where everybody works together against the
Yeah.
game. And, sort of the best example of that is Pandemic, which is now really hard to play because of the irony. But I'd really like to see like a lot more people growing up playing those games instead of Monopoly, and appreciating like what does coordination between people take, and how effective it can be in terms of achieving shared goals.
Yeah. Yeah, I mean, I don't know, man. Something very positive Monopoly taught me though, is that, man,
Oh yeah.
dude, when I played Monopoly as a kid, I was a monster. I was terrible. I would go out of my way to just be as heartless and cruel as possible. And like, playing that game, I mean, I think it's kind of the genius of the design is that if you can realize, those differences in choice and those differences in behavior while you're playing that game, you can make the conscious decision not to be that person. Because I mean, nothing is more clear cut on
Hmm.
the pitfalls of consumerism and capitalism is Monopoly.
Hmm. That's interesting. In my house, when we played Monopoly when I was growing up, we I don't know if it's legal or not. I guess it was our house rules. We allowed a lot of like negotiation and bargains and coalitions
Yeah,
among
yeah.
players. So my mom and I used to basically make deals and wipe everybody else out, and then it'd be, us against each other at the end. So I more learned about like, how to try to strike a good deal than anything else from that game.
Yeah. Yeah, I mean, which is definitely a skill that's useful. So I don't know, I guess kind of taking a step back into COVID, we're getting to the end of the show there, so there's definitely a couple more questions that I wanted to get your particular opinion on. Healthcare in 30 years, what do you think it's going to look like?
Oh, I mean, I sort of have to compare it to what is the difference between healthcare now and healthcare, let's say, 30 years ago. And most of the difference that I've seen has been, well, we've got more treatments and more technology, and some things we can deal with better, and that's great. And then we've also got incentives in the system that make some things a lot harder, and maybe we'll fix some of those. There's some people who say 30 years from now we'll have AI doing almost all the diagnosis, and I don't think so. I don't think things will change as fast as some people think they will. But I do hope that of course, I hope that we have more effective treatments and preventive strategies and diagnostic tests, and that they're more accessible and affordable and available. But I think at the heart of medicine really still is the practice of healing and personal connection. And I would hate to see that squished out, and I don't think it will be. I think maybe doctors will have a fancier stethoscope, but you'll still want to talk to a person, not necessarily about what's going on in your body, but about what it means for what's going on in your life.
Yeah. Man, that's a great way to end too, because I really hope that, I mean, if there is, these advancements in AI, that doctors will have more time and more resources and tools to kind of focus on that patient-centric approach, and try and look at health as more of a whole experience as opposed to just a physical one. And I mean, I think that's also something that COVID, can kind of help us with, shifting that towards, because, with so much focus on, the emotional struggles, the financial struggles, right? Really, all the failings of society in this time, it really shifts our focus on what is important and what should be important when we want to help and heal others.
That'd be great. From your mouth to God's ear.
All right, folks. And this has been Alan Schwartz. Definitely pick up his book. It's on Amazon, Listening for What Matters, Avoiding Contextual Errors. Honestly, it is a dense read. I won't lie. I'm one of those guys that had to probably read each chapter like 2 or 3 times just to kind of like get a lot of information out of it. But you know what? A lot of the patient examples that they give, displaying the information in like short little stories about these patients, it really makes it a very enjoyable read, and it really, kind of gives you um, kind of gives you the context of the story in a way that's relatable. Because I know that at least for me, reading more of these academic books, can be a bit daunting when you're, kind of looking at it from the outside. But seriously, folks, once you kind of get into it, it's a great read. It's an enjoyable read, and more than that, it is an informative read. So, Dr. Alan Schwartz, I want to thank you for joining me today. It was great talking with you, and I learned a lot.
Thanks very much. And if I can, I'll pitch Saul's new book too. If you have any listeners who want to be doctors or nurses or physical therapists or medical assistants or whatever, he's just published a book called On Becoming a Healer, which is really about the journey of developing yourself as a clinical person. That is also fascinating. It's not really an academic read. It's about his story and what he thinks it means about healthcare now. It's a good one too.
Awesome. Yeah, folks, check that one out. That one's available on Amazon too, correct?
I think it will be, yep. I know you got it for pre-order. It'll be anytime now.
Awesome. Well, then, folks, look that one up as well, because, Amazon has absolutely everything you could ever have and then some. I just got a 12-pound bag of gummy bears the other day. All right. Good night, folks.